I also used this caliper, which was designed by Dr. Arthur Swift from Canada. And this caliper allows you to show the patients what the golden ratio is. The golden ratio comes from the phi number, which Leonardo da Vinci used in his paintings and all the buildings that he designed. And there are ratios. For example, the lip is 1 to 1.6. So for example, if we measure this here would be 1, then the lower lip would be 1.6, and we can see that this ratio here is respected.
Wow.
Another example that we can look at, if we measure here what we call the intercanthal distance, this is a distance that does not vary with age. Typically, if we go here, we can see that the peak of the eyebrow of Christina matches this measurement, which is quite normal. The width of the nose matches this measurement, which is what we would expect. The width of the thick lip matches it, as well as the width of the chin. So we can see that Christina fulfills the golden ratio peak, and this is where the peak should be. Now, there are also other ways of doing it. You can draw a line from here downwards, and a line from the ear to the nose, and then the intersection point is the peak of the cheekbone. Another thing, sorry, I can also show you is the forehead. The forehead has a slant in women, and if you put here on your forehead, you can see that it's perfect. But if you look here, if I put it here, you can see that there's this very, very slight 2-3 millimeters missing, because we tend to age here and we lose some bone. And I could put some product here to make it as smooth as this area. See if we go into details. Christina, summarizing the treatment plan that we did. So we saw each other 2-3 weeks ago, and Christina mentioned that she would want to look less tired, less saggy, and younger. In order to achieve this treatment, we started by treating Christina with Botox. The Botox will reduce wrinkling in the forehead, in the glabella here, the famous 11, as well as the crow's feet. It will open the eyes, elevate the tail of the eyebrow, and make people look fresher and younger and less tired. We also decided to contour Christina's face in order to make it more defined, and also to improve the sagginess, which was one of her complaints. She wanted to look less saggy. So we treated the temples. The temples are extremely important in all rejuvenation treatments, because it lifts the corner of the eye and even lifts part of the upper face, improves even the tear trough, because some of the envelopes that pass through here are connected to this mass, which is a very important structure in the face. It is this structure that surgeons use to do facelifts. Then we continued further down. We treated this area of the cheekbone, which is a very important support for the face, as well as this area, which we call CK4. These areas, by pulling backwards, will improve the nasolabial fold, as well as the jowling in this area. Then we proceeded to do a bit of filling here to treat the tear trough area at the cheek, in order to have a nice continuity here and avoid any abruptions. Then we proceeded to treat the chin area, which is important to give structure to the mouth, as we lose bone in this area. So this allows to give structure and treat the jowling by pulling it from here and by distracting from here forward. Finally, we restructured the lips by giving them a little bit of volume. Treatment should always be symmetrical in the lips. The upper lip should always be 1 to 1.6, which means almost 1 to 2, the lower lip being a little bit bigger. Finally, we did some touch-ups by reducing the nasolabial folds and improving the transition between, as we can see here, the transition between the forehead and the cheeks, as well as the tear trough area. So now 2-3 weeks after the treatment, Christina looks as beautiful as always, but she looks more rested. She does look younger, and she is definitely less saggy, more contoured, with a slimmer face and an oval face compared to previous pictures.
Yes, I do have a drastic before and after, actually. Okay, thank you, Doctor,
Thank you.
very much.
Thank you.